Hi everyone. Let us quickly revise what ISFIGAN 2021 guidelines say about diagnosis of GERD, that is gastroesophageal reflux disease in children. If somebody asks you what is the first line investigation in suspected GERD, it will be upper GI endoscopy. Upper GI endoscopy, if you find that there are clinically visible erosions, that is the most definitive sign that the patient is having GERD. If there are no clinically visible lesion, you need to take biopsy and there are histological criteria for that. The second investigation, which is more sensitive, but it is usually done in patients in whom upper GI endoscopy is inconclusive, is MII-PH study. MII is multi-channel intraluminal impedance combined with esophageal pH monitoring. This is considered to be the most sensitive and specific investigation, which also detects not only acid reflux but also non-acid and alkaline reflux in the patients. Usually employed where atypical symptoms are present or if upper GI endoscopy is inconclusive.